Karamoja sub-region is one of the highest malaria endemic areas in Uganda, with a 34% prevalence rate amongst children below 5 years. Malaria is the leading cause of death in Karamoja among children under 5 years. Medics in Karamoja attribute the high prevalence rate to limited access to health services, low literacy rates, and poor health-seeking behavior, among others.
In the whole of Karamoja, we have around 23 sub-counties without a single health facility out of all the sub-counties we have in this region.
The community in Pateints, in Chukudu, where a population of almost 10,000 people don't have a single facility. To go to the next facility, you have to move a radius of 30 kilometers. So with insecurity, it makes it even more difficult for people to access facilities. So people prefer to use alternative medicine to survive. They can use herbs.
People, especially children, come to health facilities when they are already very sick, when a lot of complications have already set in.
This is the reason why Malaria Consortium is implementing seasonal malaria chemo prevention by administering anti-malarial medicines to children below 5 years in the 9 districts of Karamoja sub-region. The senior country technical coordinator at Malaria Consortium, Dr. Anthony Nuwa, explains more.
Have 35,000 and all the 35,000 are expected to get this medicine. We're giving them monthly doses of Fancida and amodiaquine, that is the local name, but it's called the sulfadoxine pyrimethamine and amodiaquine, a combined medicine.
Village health workers are key in administering drugs. Members of Parliament and medics in Karamoja commended SMC program in reducing malaria.
The preventive approach in the Karamoja sub-region is yielding results. Before the launch of the SMC, the malaria cases were so high. You would actually find that out of 10, 8 people would test positive of malaria. But today, in the follow-up and monitoring program by UPFM and Ministry of Health and Malaria Consortium, we have discovered that out of the 10, 4 are positive of malaria. And I'm so excited that the district chairperson, the RDC, and then the in charge of the health facility we visited actually alluded to this. They confirmed that the malaria cases have now reduced because of this intervention. I now call upon all the stakeholders of Uganda, especially the Parliament of Uganda, to support us in this so that when we ask for an increase in the budget towards the fight against malaria, there is a noble cause, because there is a reality on the ground. Where there are supplementaries, let part of it be for the fight against malaria.
Them get to know that this treatment is a success story so far. So the community needs to get to understand so that they embrace it. So I call upon the local leaders, the LC1s in the villages, to put effort to make sure that they mobilize the villages and let them be informed. I want to thank the village health teams, the few we met. I'm sure the others are also the same with the one we met. They are doing a credible job, and I want to encourage them to continue.
Lemokol wants SMC expanded to other areas where malaria prevalence is high.
So we for sure feel SMC is a very good intervention, and I think there would be need to consider expanding it to several other high transmission districts as a priority to control this burden of malaria. And then also advocate for other interventions like I've already mentioned, indoor residue spraying. And then
Members of Uganda Parliamentary Forum on Malaria, led by the Vice Chairperson Christina Polot, visited Moroto and Napak districts. This was during the launch of new round for seasonal malaria chemo prevention to children below 3 to 59 months in Napak districts. The cycle is going to run from May to September this year across the 9 districts of Karamoja.